Tennessee Governor Bill Lee wants seniors who contract COVID-19 to ask their healthcare providers about certain drugs that could help keep them out of the hospital. Lee says monoclonal antibodies are available and very effective, especially for those 65 or older and have underlying health conditions. Crestwood Medical Center and the Huntsville Hospital System have those treatments available. Our Nick Norman tells us more about the technology behind the treatments and who may be eligible to receive one.
When we get exposed to any type of infection, our body will produce different proteins to fight that infection. And that protein, one of them is called antibody.
Researchers looked at the antibodies that fight the virus and were able to imitate them. Those imitation antibodies are what are in the infusions allowing people to better fight COVID. But these antibody infusions are only available to a specific group.
It's 65 and above, or 55 with risk factors, we call them. Now, if you're young, but you have what we call a BMI or obese, morbidly obese of 35, and you have high blood pressure and heart disease, you might be eligible for that. So it's definitely certain demographic, and those are more vulnerable for complicated COVID. It's not the healthy young patient because there is limited supply of it, and it's only done in the outpatient setting. We don't do it when the patient get admitted.
You not only have to fit this demographic, but you also have to test positive and receive the infusions within 3 days of receiving the positive test. This not only helps those with early detected COVID, but also helps the hospitals. These infusions can keep people from getting admitted. This keeps ventilators and beds open for those with a more progressed COVID case. And if you are eligible to receive this treatment, this is what you can expect.
It's usually about an hour infusion where you monitor the patient for any allergic reaction and then keep them after that for about 15-30 minutes.
Hassoun says allergic reactions are very rare and that this treatment is free under emergency use authorization. But again, you must be eligible to receive one. Putting the Valley first, Nick Norman, WZDX News.